Hi there, Dr. Tansavatdi here. So this video is going to be going over post-operative instructions for rhinoplasty. If you are having another procedure combined with your rhinoplasty, the instructions will be in a separate video. This is only going to be focusing on rhinoplasty, and again, as I've mentioned in previous videos, the explicit instructions, the detailed instructions may change from patient to patient, so this is meant to only be a general overview of the instructions that you're going to be following after surgery. There may be separate ones. I may change on day 7 or day 10 or 2 weeks. I may have you be doing some separate exercises that have not been alluded to in this particular post-operative instruction video. So I'm going to start off by talking to you about what to expect right after surgery. So right after surgery, the day of your surgery, you're going to be either here or in the surgical center. You're going to be in the recovery with a pad collecting blood that's under your nose. That's called a mustache dressing. That mustache dressing will be placed with a piece of tape just covering underneath the nostril, and that's to collect any blood that's dripping from your nose. It is typical to have bleeding for the first 24 hours after surgery. So don't get alarmed if you feel that you're changing this pretty frequently. The first few hours after surgery, you'll likely be changing it once an hour, or maybe even more frequently than that. If you put on the new dressing and it soaks through and it's bleeding through, where you see the drip of blood through, that is not common. So if that were to happen, then please give our office a call. If you're just changing it regularly once an hour and it's just getting soaked in that 1 hour, that is totally normal. So just be aware of that you may be changing more frequently the first few hours after surgery. Then towards the night, by the time you get towards the evening, you'll find that it should start to slow down. After that, the next morning, you may have only changed it once through the whole night, and that's okay. That should be normal. However, if you are changing it more frequently through the night, that's okay too, because everybody's going to be different. Just know if it's not bleeding heavily where it's gushing, then that's totally fine, because everybody's going to be different. The next morning, you're going to be coming in for a post-operative appointment. Some of my patients I have come in for their next day appointment. If you live further away, where it's more than an hour away, we may have you just stay at home and we may just update with a phone call to you. The first day post-operative appointment is really just to make sure everything looks good. When you come in, I'll be taking off that mustache dressing. I'll be taking a look inside the nose just to make sure that everything's drier than it was prior to, or right after surgery. The bleeding should have calmed down to a point where it's just a trickle. And then I will change the mustache dressing, or I may decide, hey, it's dry enough, we'll just remove that. The other thing that I'm going to be viewing is just to make sure that the tape that we've applied is dry. If it's stained, sometimes I'll put a new piece of tape just to cover up over that area, just so that it makes it look a little more presentable. The other thing that you're going to be doing is if you have a cast, not every patient I'm going to put a cast, but for those patients who have a cast on their nose, the tape will be covering and holding that cast in place. You can use your glasses. If you wear glasses, you can use glasses over that cast. If you have contacts, if you want to use your contacts, you're totally fine to use your contacts. But know that if you wear glasses on a regular basis, or if you wear sunglasses, you can only do that while the cast is on. So once the cast comes off, usually at 1 week, when you come for your 1 week appointment, I take that cast off. When I take that cast off, then you cannot be using your sunglasses directly on the bones, particularly if we've fractured the bones. We don't want the glasses sitting on there, because it can shift the bones and where they're sitting, where we've moved them to. The other thing that you're going to want to know is that if you do want to wear your sunglasses, we're going to provide some tape at your first post-operative appointment, and we'll show you how to apply the tape so that you can place it. I know it looks funny, but you're going to be putting the tape right on your forehead, and that takes the weight off of the glasses, so they're not sitting right directly on the nasal bones. The other thing that you'll do too is, if and this is only going to be a couple of my patients, if I'm having you wear the cast for longer than the 1 week, we might give you the mold of the cast. After we take off everything, we might form a new mold, and that mold you're going to be using for a couple more weeks after. That's particularly if you've had a very crooked nose and we want to make sure that it stays its shape. You'll be wearing that cast, and you can, if you do wear a cast, then you can put the sunglasses over, okay? But if you're not having the cast on, then that is where we want you to wear your sunglasses or your glasses using the tape and applying it to your forehead so that the glasses do not sit on the bones. Next, so the following day, if I see you at your first post-operative appointment, you're going to be starting Afrin starting at that point. The Afrin nasal spray you will have received in your bag at your pre-operative appointment, and that spray will be used 4 times a day for the first 4 days. So I try to make it simple, 4-4. That means day number 1 after surgery, you're going to start spraying your nose. And at first when you spray, you may see that the spray just doesn't go in, and that's okay. That's okay. I just want you to try to get some of the spray up. It will help to open up your airway, and if you do have some bleeding still going on, it will help to minimize that bleeding, so it will constrict the blood vessels. The spray is also helpful for after surgery, many months from the time of the surgery if you do have some congestion. But I really want you to just use it for the first 4 days and then stop. Don't use it beyond the 4 days, because after you use it for 5, 6, 7 days, your nose is going to start to get used to it. So when your nose gets used to it, when you spray, it will relieve the congestion for a short period of time, and then it's going to come right back. And then you're going to get addicted to it just using the spray. It's not like it's like cocaine or narcotic where you get addicted to it in that sense, but it's the inside of your nose that's getting addicted to it, so it won't be able to come off of the spray without feeling like you're congested, and so we don't want that. So first 4 days and then stop. Then after that, the instructions, if you read the instructions, it will talk about using the saline sprays. Saline spray is only to be used actually if you feel dryness in your nose. The first week you will not feel dry. Your nose will feel wet, okay? So you may have dripping, you may have clear dripping from your nose, and so you don't need to use a spray if your nose is feeling wet. But after the first week, when I take off the cast, if there's splints that I've placed inside the nose, those come out at 1 week. And when they all come out, that's when your nose will start to feel drier and drier because it's starting to heal. And as it heals, then you may want to use this to spray within the nose to keep the nose feeling moist. The other thing that I might add, and it's going to be on a case-by-case basis, but I might have you using saline irrigation sprays. So the irrigation bottle we can provide you at your post-operative visit if I think that you need to use that. And what that will do is clear out the sinuses, will clear out the nose, particularly if there's a lot of dry debris inside the nose, because there's crusting that's going to develop, particularly along the sutures that are inside your nose. And we want to just clear that out, but without you picking at them, because we don't want you to tweeze, we don't want you to pick inside your nose, because if you pick, it could be a suture that you pull out, so we don't want that to happen. So you're just going to want to use the saline irrigation in those cases to kind of clear out the nose. You can get that at CVS, Walgreens, or any of your pharmacies, or you could get that at Target. I believe that's at Target. And the name of that is called Neilmed, Neilmed, sinus rinse. You could also find that as a neti pot. I know some people know that as a neti pot. And you want to use water that's distilled, or you take the water from your tap and you boil it to dissolve the salt packets. Do not use water from the tap directly to dissolve the salt packets, because it can introduce bacteria into the spray that you're now irrigating your nose. Okay, so you want to use distilled water or the tap water that's been boiled. Next thing that I want to talk about is that starting the day after, you can start taking a bath, but you don't want to run any water over your face. So you can shower. If you have one of those hand sprays for showering, you can do that. Or if you want to take a body bath, that's fine. But keep this area as dry as possible for the first 3 days. After that, you can wash your face, but you don't want to heavily get the area wet because we don't want the cast coming off. I do use a good amount of glue to keep the tape and cast on. So it's not going to come off unless you're like soaking it heavily. So we don't want that to come off. So you can wash your face, you can take a shower and run it over your face, and then after you're done, gently pat the area dry. Don't rub or anything like that. You want to sleep on your back for the first 3 days. If you can do it for longer, if you can do it for the week, it's going to be more effective. But sleeping on your back with your head elevated. So you want your head higher than your heart. And that will allow the swelling to come down your face and neck and come down back to your heart. So that will speed up the healing process. You're going to be also using cold compresses. Now, what's the best way to do this? After surgery, I typically tell the nurses not to use a bag of crushed ice and putting it over because there's pressure that's going to be applied where we've just fractured the bones if we've done that. So what's usually helpful, what I've told my patients and what I expect for you to do, and this is what a lot of my patients have found helpful, is get a wet washcloth, baby small washcloth, get it wet, put it in the freezer, and then when you want to use it, you'll pull it out of the freezer, you break it up a little bit, and you apply it right over your eyes and over the cheeks, and that will help with the bruising and swelling. The washcloth, then you use it for 20 minutes, and then you get it wet again, wash it out, wring it out, put it back in the freezer. So for the next hour, you'll do it again. So once an hour, you're going to be doing for 20 minutes. If you could do it for more frequently than that, do that, you can do that, but you want to take some breaks in between. So if it's for 20 minutes, then you take a break, and then break it for 20 minutes, and then go back to using it again for 20 minutes. So it'll be 20 minutes on, 20 minutes on, 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off. And do that while you're awake for the first 3 days. You don't need to be doing this in your sleep. We don't want you like not getting sleep. Sleep is important to healing. So get enough sleep. Do this during the day, and then when it gets time ready for sleep, you can discontinue doing that, okay? You want to do this for the first 3 days. Icing is very important for the first 3 days. It's just like if you sprained your ankle. When you sprain your ankle, they say rest, ice, and elevate. So that's what we're doing here. We're elevating the head, we're icing the area, and we're resting. So that means also don't try to do a lot of motion of your upper lip, because we've done some work here. Typically, I've made my incision down here, or if I haven't made an incision on the outside, there's still some work on the inside and it's affected this upper lip. So know that the upper lip will feel stiff, it might feel numb, it might just feel swollen. So as much as you can, minimize smiling, minimize laughing, minimize chewing. So sticking to a soft diet for the first 3 days is important. If you could do it for longer, even more helpful. Another thing that I like to emphasize is what kind of diet should you be on after surgery. This is going to be true for all the types of surgeries that I do, and that is sticking to a high protein diet, less carbs. And I know that sounds unusual, because some people want to go right to getting some sugars because that supposedly should help with the healing process. But a spike in sugar actually can cause a release in IGF, which is insulin growth factor, and that stimulates inflammation. And we don't want inflammation after surgery. We want your body to heal. So higher protein, less carbs. I'm not saying no carbs. So carbs are okay, but you probably want to stick to not your white bread, brown rice, something that's a little bit slower release of the sugars, okay? And if you need more information, you can look up the information, Google it, but you want to find out where you're not doing your white starches, okay? So look for more complex carbohydrates. Next thing I'm going to talk about is drinking enough water. Important that you drink enough water because your body needs fluid. It needs to hydrate in order to heal faster. It's just like lubricating a car with oil. So drinking enough water is crucial after surgery. Another thing that I usually emphasize is walking. So what I do, I've only operated on the neck up. So that means everything down below, your arms, your legs, you should be able to move. That means that you should get up the next day after surgery, even you're coming to see me, or you're walking around in the neighborhood. Or you just walk around the house if you don't want to go outside, but you want to get up and walk several times a day. And that's going to prevent the chance that you could develop a clot in your legs. We don't want a clot that could potentially lead to a deep vein thrombosis. And what is that? That means a clot that can migrate, go up to your lungs and cause a pulmonary embolism. And that is something that's life-threatening, so we don't want that. All right, so I've emphasized a lot of the most main points. Some of the more general information that I want you to know besides what I've talked to you about that will apply to all types of surgery is you want to minimize how much talking you do. You want to minimize how much smiling. We talked about smiling, chewing, sticking to a soft diet. You're going to also, you're not going to be swimming for 3 weeks, because anytime there's an incision, we don't want to get the incision wet, it could open up. So no swimming, no heavy lifting for 2 weeks. That means anything over 20 pounds. Okay, so anything over 20 pounds would mean your pet, your dog who is over 20 pounds. If you have a very tiny pet, tiny dog, that's fine. But most dogs are over the weight of 20 pounds. That also include toddlers, or if you're a grandparent, or you're watching kids, you're doing some babysitting. All that stuff is out of the question. So you don't want to be lifting anything heavy. Then after the first 2 weeks, you can go back to exercise. It's okay to go back to resuming your exercise, but I want you to take it slowly, not go straight back to your normal exercise that you've done. So that would be, let's say you do big cardio workouts where you're on the treadmill or running like a couple miles a day. We want to slowly transition into that. So that might mean that you go on a fast walk or a slight jog before you go straight to running a couple miles, okay? So that's important, that you're not hitting right to the gym. Some other tips for you is that I do say that if you do have a partner and you sleep with your partner, you might want to get either a king bed, or if you don't have a king bed, avoid sleeping in the same bed for the first 2 weeks, and even more longer if you can, because if you're close to one another and your partner rolls over and hits you in the nose, that can then disrupt the bones that we've just worked on. So anything that you can think of that could potentially put your nose in harm's way, damage, that could be playing tennis, that could be playing basketball, that could be any number of sports where there's a potential where somebody could hit you in the nose. That's what you want to avoid. Now, it sounds like I'm asking you to baby your nose, but yes, because the worst thing that can happen is you shift the bones or you damage what has been done and we have to go back to surgery. So that also means kids, because you cannot really predict what your 2-year-old is going to do, what your 3-year-old is going to do. They may bump you in the head. You're hugging them, and this could be after the first few weeks and you're still not completely healed, but you're hugging them and then they whack you in the nose. That is common. I've heard it so frequently from my patients. So I just want to emphasize that you are not doing anything that could potentially put you in that scenario. So if that's the case, have your spouse take care of your child for you in terms of lifting them up and doing anything like that. So that's crucial for the first 6 weeks. I'm giving you the timeline. First 6 weeks important, that you're not going to put yourself in that perspective, okay, in that issue. And then I think we've talked about majority of this. One other thing, if you look at your post-operative instructions, please bring it up so you have it in front of you while I'm going over this. But I want to emphasize too about your nose. This is one of the important key aspects, is nose blowing. Because a lot of times people will feel like an itchiness in their nose, they want to blow their nose. The first week, absolutely no nose blowing. The second week, you can blow your nose, but gently from one side, gently from either side, but not through both nostrils. And then after the second week, you can then gently blow through both nostrils. Again, gently is the emphasis here, not strongly. Other part of this is sneezing. Sneezing or sniffing. If you're going to be sneezing the first week, you want to do it with an open mouth. I know that sounds hard, but most people close their nose when they're going to sneeze. You're going to do that without putting any pressure on your nose so that you can sneeze with your mouth open, putting less pressure on your nose. Sniffing is also a no-no for the first week. After that first week, you can slowly get back into your routine, but the first week is crucial that you don't do those activities or don't do those particular things. And then what are some typical things that are normal and what's abnormal? So some tips: it's normal to feel some pain after surgery. It is okay to feel discomfort. You will feel some pain. The first day is the time that you'll feel the most pain. After that, it's going to be more like discomfort, which means there's some pressure. There's, if you lean over to tie your shoes, if you bend over, you'll feel some pressure in your nose. That's typical for a couple weeks after surgery. You haven't done anything wrong to your nose. The other thing that you'll notice too is if you are touching your nose, it may feel numb, particularly the tip of the nose. That is also normal. And that can happen for up to about 9 months to a year, and sometimes longer. Everybody's different. You could get back your sensation within a few months, but typically it's several months out. So 9 months to a year is typical for the numbness to finally come back. As the sensation comes back, you will feel like you'll have some pins and needles, some shocks here and there, and that's quite all right. That's normal. There's nothing wrong that's happened, but some people will just describe it as it's a different sensation, and that's okay. If you do have any concerns about that, give our office a call or send us a message. And then anything that's out of the ordinary that I've described here, if anything that's not filled out, talked about in this video, that's not the general post-operative instructions or the post-operative things to expect after surgery, if I haven't outlined it here and you have a question about it, please give us a call or email us, and that would be at info@facesbydrt.com. You should have also had an access to our Simplast app, and you can send that securely, send a message. That would be through to our medical assistant. That could be Yvonne Chang or Sarah Landers or myself, Dr. Kristina Tansavatdi. We might also have other staff that may change from time to time, but we will let you know that, and you can contact through the Simplast app to those particular people. Last but not least, our phone number. You can always reach us during normal business hours, and that's 805-715-4996. Thank you.